Welcome to today's lecture where we're going to be looking at the cardiovascular system, which is chapter 26 in your textbooks. So before we get started, we're going to go over some basic facts. The body's going to be 60 to 80% fluid by volume. So a lot of times you'll hear people say we're 70% water. This is what we're talking about. And in order to maintain health, we're going to have to be able to circulate this fluid to keep it fresh and stagnating. And it's the job of the cardiovascular system to accomplish that. And when we say cardiovascular system, what we're doing is we're talking about a network of tubes in which this fluid is going to be transported to every cell in the body. So as far as the anatomy of the cardiovascular system, we're talking about the blood, so the cells that compose of it, the vessels which carry them around the body. Those are going to include arteries, veins, and capillaries. And we're going to need a pump to circulate it all through the body, and that's what the job of the heart is going to be. So for the physiology, there's going to be three main components. Obviously, the first one is going to be transportation. Blood's going to carry around oxygen and carbon dioxide, so we're going to call those respiratory gases. It's going to deliver nutrients that we receive from the digestive tract. We're going to use it as part of the immune system, protect the body. So it's going to transport antibodies or white blood cells. We're going to remove waste materials, transport those hormones we saw in the endocrine system, and it's going to be a way to kind of mitigate heat when we dilate or constrict those blood vessels near the surface of the body. As we just said with antibodies, it's going to serve as a protective mechanism involved with the immune system. And we also need components which are going to stop us from bleeding uncontrollably, and that's known as stopping hemorrhage. So we're going to have blood clotting mechanisms to prevent the loss of too much blood. So then some kind of random blood facts. As we said, it's going to transport nutrients to each individual cell. Again, we have trillions of cells. Each of those cells is going to need a supply of oxygen and carbon dioxide, or oxygen and glucose. So as we see, there's going to be capillaries embedded all through our body. Again, it's going to take those waste materials, so that carbon dioxide, away. It's going to be a viscous fluid, so it's a little bit thicker and more adhesive than water. That's going to be because of the solutes and kind of the other components we find in it. It's going to be slightly alkaline, so its pH is going to be above 7. We're going to have a very narrow range in which we want our blood, so about between 7.34 and 7.38. Any deviation from that range, we're looking at a very unhealthy situation. But we're going to have many buffers that keep us within that pH. It's going to be warmer than normal body temperature, about 100 degrees Fahrenheit. As we saw in the skeletal system, it's going to be created in the red bone marrow. And if you remember, the process of blood cell development is going to be called hematopoiesis. Some other blood facts. It's going to travel in a cardiovascular loop. So when we say the cardiovascular system, it's going to be a closed system. So all the tubes connect to each other, and they're going to go in a circle around the body, dropping off oxygen, picking up carbon dioxide, and doing that over and over again. So it's going to take about a single blood cell to about 60 seconds to make it all the way around. When we look at the components of blood, it's going to be about 45% red blood cells, about a small percent of those white blood cells and thrombocyte, those clotting factors. And then all these cells are going to be transported in a liquid medium, which we call plasma. The plasma is going to be what carries these cells around the body. And that's going to be about 90% water and 10% solute, so things dissolve within that plasma. It'll make up about 8% of our total body weight and approximately about 5 liters of blood in the average adult. So when we say it's dangerous to lose too much blood, this is about how much we have in us. And if you remember, it's going to be classified as a liquid connective tissue. So then looking at the different blood cells, the first one is going to be the red blood cell, which is called an erythrocyte. And the job of the red blood cell is to transport oxygen and carbon dioxide to and from cells. So obviously this is very important. We're going to have many, many, many red blood cells. By far they make up the most cells of the body. I believe it's 80% of our body cells are going to be red blood cells. And it's going to be, so obviously then it's going to be the most numerous type of blood cell. And the way they're designed is to be flexible, and they're going to have a bioconcave disc. So it's kind of like an inner tube, but it's not quite hollow. It's just going to have a divot in the middle. So it has a flat middle and raised edges. And it's this design that allows them to be flexible because these capillaries that they flow through are going to be very, very tiny. So they're going to kind of squeeze their way throughout them. And the shape also allows them to have greater surface area to carry more oxygen or more of those respiratory gases. So a mature red blood cell, since its only job is to really carry oxygen and carbon dioxide, it doesn't need other organelles or even a nucleus. It's going to be created and it's going to do its job, but because there's no nucleus, it doesn't undergo mitosis. So when its lifespan is over, it's going to be replaced and it's going to die off. So the average lifespan of a red blood cell then is going to be about 105 to 120 days normally. And the protein that's responsible for carrying these respiratory gases is going to be called hemoglobin. This is an iron-based protein that binds to those respiratory gases. And I'm sure we've all tasted blood at some point and it kind of tastes like a metallic taste. And that's because hemoglobin is made with iron. And on these red blood cells, we're going to have surface proteins that are going to signal to the immune system if they belong to our body or not. So we call this the ABO blood types, which we'll look at in a little bit. The next type of blood cell is going to be a white blood cell, also known as a leukocyte. And these are going to be our immune cells. So you can think of them as a mobile army that are going to protect our body from pathogens like viruses, bacteria, fungi. So their job is to remove dead cells or foreign substances. And their lifespan can vary from hours, days, to years, depending on the type that we're talking about. We'll go over these white blood cells a little bit more in the immune system, but really it's beyond our scope for this class. So just because the book has it, I'm going to show you the types of white blood cells, but I'm not going to ask about these on the test. There's two main categories. There's granular white blood cells produced in bone marrow. And the reason they're called granular is because if you look here on the picture, they're going to look grainy under a microscope with these little particles in them. These are going to be neutrophils, eosinophils, and basophils. The other type then are going to be non- or agranular, and these are produced in lymph tissues, which we'll look at in the lymphatic system. And these are going to be termed monocytes or lymphocytes. And basically you can see there's no granules inside these. Don't worry about any other distinction between them. And the third type of blood cell is going to be a thrombocyte, also known as a platelet. These are going to be derived from larger cells that they break down into cell fragments and then float in the blood. And they're going to be jagged shaped that helps them adhere to rough or torn surfaces. The idea is if you have a break in the blood vessel, these jagged platelets are going to be able to form a blood clot to prevent more bleeding. So here we can see the platelet in the middle, and then as it activates, it's going to extend these arms to catch other fragments to create a clot. So they're going to release a substance to activate blood clotting and cause a platelet plug. When we say platelet plug, we're talking about a clump of sticky thrombocytes that are going to seal damaged blood vessels. And they're just going to become larger and stickier as they grow. The process of blood clotting then is going to be known as coagulation. And this is when the liquid blood transforms into a thick gel-like state. So a clot can form within minutes. And to assist this, there's going to be very fine mesh-like threads found in the plasma called fibrin. You can see here the fibrin is going to act like a net. It's going to catch and trap red blood cells, platelets, and fluid. And this is what allows for the coagulation process to happen. And then once formed, the clot's going to tighten and pull on the edges of the damaged blood vessel, and hopefully you're no longer bleeding. And then lastly, we have to talk about the fluid that transports all these cells, and that's known as plasma. It's going to have a straw-like color to it, and as we said, it's 90% water, 10% solute. So it's going to have those electrolytes dissolved in it, different proteins, hormones, and enzymes that the body is going to use as a transportation system to get to other cells. As we said, those red blood cells are going to have different classifications based on the presence or absence of proteins that you inherit from your parents. These are going to be type A, type B, type O blood types. So we're going to quickly look at the different types. I still don't know my blood type, so at some point you should know your blood type, especially if you would ever need a transfusion for any reason. But the first one we're going to start with is O, in particular O negative. O negative means that there are no proteins on the surface of this red blood cell. So this is important because when we donate blood, the fact that we have no proteins on the outside makes O negative people what we consider universal donors. This means that we can give blood to anybody with any blood type because since there's no proteins on the outside, it's not going to raise an alarm in someone's immune system. So the red O-negative blood cell can just pass through undetected, do its job perfectly. The only problem is if you're O-negative, this means you can only receive other O-negative blood types during a transfusion. Because if you had any other proteins on the outside, your immune system wouldn't know what they are. They would think they're dangerous, and they would start to attack these foreign red blood cells. So it's if you need a transfusion, you're O-negative, it's much harder to find a good blood donor because you can't use A, B, or AB blood. So then when we say a blood type is positive, what we're saying is there's a Rh factor protein that you find on the outside. So negative, there's no Rh factor. Positive, there is no Rh factor. Moving on then to type A negative, there's just an A protein on the outside. Or an A positive, you have the A protein and the Rh factor. Then obviously B negative just has the B protein. B positive is B plus Rh. And then you can inherit both an A and B. If your mom's an A and your dad's a B, you'll now be a type AB blood type. And then AB positive will mean you have all three antigens or proteins on the outside of your red blood cells. And this means that you're going to be a universal recipient. So because you've lived your whole life with all these proteins on your blood, your immune system recognizes them as your own. So you can receive blood from any other blood type. If you get type A blood, your body's used to seeing A, so it's fine. You get type B blood, it's used to seeing B. And if you get O, obviously, it's still safe. So being AB positive is a good thing if you need transfusion. And here you can see a chart. As we said, AB positive can receive blood from any other blood type, whereas O negative can only receive O negative blood. And you can see the other in-betweens here. So this is just a slide to kind of sum it up, but we just went over it. So then how do we get this blood to go all throughout the body? That's going to be the job of the heart. So when we talk about the heart, it's going to be a hollow, very muscular organ, about the size of a clenched fist that you'll find located right behind the sternum between both of your lungs. As we said, its primary function is to beat and pump that blood and pressurize it through the cardiovascular system. So then looking at the anatomy, surrounding the heart, we're going to have a double layer sac called the pericardium. So here in blue is our pericardium. And there's going to be different layers to it. As we look at more organs, we'll see these terms parietal and visceral. A parietal layer is going to be the outside fibrous layer here. And then there's going to be a second layer called the epicardium, or the visceral layer, that's on the inside, touching the muscle of the heart. And between the heart and this epicardium, we're going to find serous fluid. That's going to be like a lubricating fluid that prevents the buildup of friction or heat. Because that heart's constantly beating, it's going to create friction as it rubs up and down. And it's the job of serous fluid to reduce any buildup of heat. And then in between the parietal and epicardium, we're going to have the pericardial space between the two layers. As we said, there's going to be a very muscular component to the heart because it's constantly contracting and relaxing. And this is going to be known as the myocardium here. And then the endocardium is just the inner lining attached to that muscular layer. If we kind of dissect the heart and look inside, there's going to be these kind of grooves that help the blood flow in and out. They're called trabeculae carneae. I'm not going to ask a lot about them, but if you ever look at a heart, you'll see these distinct grooves within it. Because the heart is a very active organ and those muscles are constantly contracting all 24 hours a day, it's going to need its own blood supply to give those cells the oxygen and nutrients that they need to keep performing. So it's going to have what we call coronary vessels that supply those heart muscles. The reason this is important, when we talk about a heart attack, this is going to be a blockage within the blood vessels that supply the heart. And what's going to happen if those muscles stop getting the oxygen, they're going to die off, and this is what we call a heart attack. And then looking inside the heart, there's going to be different chambers in which the blood passes through as it's being circulated around. So it's going to be divided into 4 chambers. Here we can see 1, 2, 3, 4. These top chambers, there's going to be two, and these are going to be called atria. It's not shown here, but there's going to be a septum. Whenever you see a septum, this is going to be a dividing point between two anatomical structures. So it would be in the interatrial septum, would be somewhere around here. And these two inferior chambers are going to be known as ventricles. And there's going to be separated by the interventricular septum, which we can see here. Between these chambers, then, we're going to have valves that allow the passage of blood through. So they're going to regulate flow and direction of blood through the heart. Here is two valves that we can see, and another valve up here individually. The two valves that separate the atrium and the ventricles are going to be known as atrioventricular valves, or more commonly, we just call them AV valves. So blood's going to pass from the atrium. This AV valve is going to open, and now it's going to enter the ventricle below. There's also going to need to be valves that control the entrance and exiting of blood into the heart. So here we have what we call these semilunar valves. We can see our one semilunar valve here. There's another one hidden behind as well. So we're going to have to look at a different view to take a look at that semilunar one. So if you notice, there's going to be distinct flaps that we see on these AV valves, and these are going to be what we call cusps. So AV valves are also called cuspid valves, and they're not quite identical on the right side of the body. First, you can also see what allows them to open and close is these cord-like tendons called chordae tendineae. So as these papillary muscles of the heart beat, it's going to pull on these tendons, and it's going to cause those valves to open and close. So looking at each individual valve, on the right side, we have a tricuspid valve, named because you can see there's three cusps here. Whereas on the left side, the left AV valve only has two cusps. So we're going to call that the bicuspid valve, also known as the mitral valve. Mitral because a bishop is going to wear that very long hat, so it kind of looks like a mitre. But mitral valve is just synonymous with the bicuspid. And the other two valves, as we said, the semilunar ones, are going to be smaller. Semilunar because they're crescent shaped, so shaped like the crescent of the moon. And they're going to be named after the vessels in which they send the blood. So we have the aortic valve, which is going to send oxygenated blood out to the body. The aorta is going to be the largest artery. So as we pump oxygenated blood out of the heart, it's going to enter the aorta, and it's going to be sent all over the body. Whereas the second valve is going to be, as you can see, this is how large the aorta is, and there's going to be arteries that come off of it to each of the organs and other body parts. The second semilunar valve then is going to be the pulmonary valve. Pulmonary, anytime you see the word pulmonary, we're going to be referring to the lungs. So the pulmonary valve is going to send deoxygenated blood out to the lungs to pick up oxygen. So the pulmonary valve here is in blue. And again, this just shows you just how many blood vessels are in the lungs so that we can exchange those respiratory gases. So this is aorta here. This is our pulmonary valve in blue. We all know the heart produces a very distinct sound, which we call the lub-dub. So that sound's created by the opening and closing of those AV valves and semilunar valves. And so part of this chapter is we're going to have to know the sequence in which the blood flows through the body. Since it's a circular loop, there's no real right or wrong way to say where it starts. But generally, I like to start up in this right AV valve, where the deoxygenated blood comes back from the veins and enters back into the heart. So this whole process is called a cardiac cycle, which is the sequence of events from the beginning of one heartbeat to the beginning of the next. So we can break this down into two phases. This is going to be seen again when we talk about blood pressure. But the diastolic or the diastole phase is going to be when these ventricles relax and fill with blood. So right now we have our deoxygenated blood in the right side of the heart, or oxygenated blood in the left side of the heart. And what's going to happen is the heart's going to relax, or the heart's going to pump, and blood's going to enter the relaxed ventricles down here. Now the heart's going to contract again, and this is going to enter the diastolic phase or the systole phase, where the ventricles contract, and we're going to inject the blood outside of the heart now. And so as this process occurs, this is where we get our heart rate from, or the number of cardiac cycles per minute. On average, it should be somewhere between 50 to 80 beats per minute. If you remember these words from the medical prefix, if you have a fast heart rate where it's over 100 beats per minute, we're going to call this tachycardia, tachy meaning fast. Whereas if you're constantly below 50 beats per minute, we would say you have bradycardia. So here we're going to go over the stages of the cardiac cycle. Whenever you see the writing in blue, it means our blood is deoxygenated. If it's in red, we're going to assume it's oxygenated. It should be said that deoxygenated blood isn't completely deoxygenated. There's still always going to be a certain amount of oxygen in it. Typically, the oxygen content in venous blood, where it's already dropped off its oxygen to the cells, is going to be about 60% oxygenated. It never gets to zero. So this is part of the reason deoxygenated blood isn't actually blue. It's just going to be a much darker shade of red. So do know that even though our veins look blue, that has to do with how light is refracted through our skin. It doesn't really mean our oxygen is blue on the inside. So as we said, I'm going to start here in the right atrium, and there's going to be these two large veins that enter into this right atrium called vena cava. We have a superior vena cava and an inferior vena cava. The superior one drains deoxygenated blood from the head. The inferior one takes deoxygenated blood from the rest of the lower body below the heart. So we're going to have deoxygenated blood enter through the vena cava into the right atrium. From here, the blood goes through the tricuspid valve and enters into the right ventricle. The right ventricle is going to contract, and it's going to send blood through the pulmonary valve into the pulmonary trunk and into the lungs. So we have lungs on bilateral sides of the heart, so it's going to exit both sides. Once the deoxygenated blood goes into the lungs, it picks up oxygen. We'll look at this in the respiratory system. And now we're going to have oxygenated blood entering back into the left side of the heart. So the oxygenated blood leaves the lungs and enters into the pulmonary veins. And now we're going to enter into the left atrium. From here, the left atrium is going to pump the blood through the bicuspid valve and enter into the left ventricle. That left ventricle then is going to contract, and it's going to send the oxygenated blood through the aortic valve, into the aorta, and then out to the rest of the body. Once the oxygenated blood enters the arterial system, it's going to pass through arteries, then smaller arteries, which are called arterioles, and into the capillary system. And it's within the capillary system that the blood cells are going to release their oxygen, pick up carbon dioxide, and enter into the veins. So as the deoxygenated blood goes through the veins, it's going to go back to the vena cava, back into the right atrium, and the entire system starts over again. Here you can see just the circular outline of the cardiovascular loop. Looking at what coordinates the beating of this heart is going to be known as the heart conduction system. So the heart rate and the rhythm of the heart are going to be coordinated by electrical impulses by specialized heart cells we're going to find throughout the organ. So these impulses are going to travel through the myocardium, and there's going to be 4 distinct areas that we're going to go over. The important one that I want you guys to know is where this conduction system starts. And it's going to start in the SA node. So this is going to generate the heartbeat and sets its pace. So it's going to be known as the pacemaker of the heart. So you find this in the right atrium. And as that SA node beats, it's going to send an electrical signal. It's going to activate this AV node, known as the atrioventricular node. And this is going to stimulate the left and right atria to contract and send blood into those ventricles. So this impulse is then going to pass down through the rest of the conductive system. So it's going to travel through what we call the bundle of His, which is going to be these 2 fibers here. And then it's going to continue into the Purkinje fibers. So I don't really care so much about all this. Just know if you see these 4 terms together, we're talking about the heart's conductive system. So then we can measure how this conduction is working through what we call an electrocardiogram. Typically, it's going to be called an ECG or an EKG. And what this is a recording of the heart's electrical activity. So this is when they put those electrical pads on different parts of your body and measure how your heart is working. So this is what you typically see on an ECG reading. Luckily, we don't need to know the different parts of an electrocardiogram, but it is in the book. So sometimes you'll see these different terms in the news, especially recently with coronavirus. They're talking about the hydroxychloroquine and how it's affecting the heart rate, and they might say it can slow down the QRS complex. So when a cardiologist is looking at your electrocardiogram, they're comparing your heart's rhythm with what a healthy one should look like. So sometimes maybe the P wave is longer, the ST segment is shorter, or there's bumps in other areas where there shouldn't be. So they're going to analyze this and see maybe what's going wrong within that conduction system. Moving on then, the blood vessels. These again are going to be part of that closed network that connect the heart, connect to the heart and the rest of the cells in the body. And there's going to be three main types of blood vessels. We have arteries, which move blood away from the heart. Arterials are just going to be smaller tubes that extend out from arteries. So here we can see an arteriole there and here as well. And veins, in contrast, are going to be blood vessels that return blood to the heart. And smaller veins we're going to term venules. So venule here, here, and here. And then in between these arteries and veins, we're going to have our capillary beds or our capillaries. And this is where the functional kind of aspect of the circulatory system takes place. So it's within these capillaries where we exchange those gases or those nutrients or those hormones or whatever. But they're going to connect both these arteries and veins. Then looking at the structure of the arterial walls, there's going to be three main layers that we're going to call tunics. So the innermost layer is going to be called the tunica interna, and this is going to be made of endothelial cells with small amounts of elastic connective tissue. So because those vessels can dilate or constrict, they're going to need to have an elastic component to them. What's going to control that contraction or dilation is going to be a muscular layer known as the tunica media. And again, this is going to be smooth muscle, so not under conscious control. And then, as always, there's going to be a dense connective outer layer that serves as a protective mechanism called the tunica externa. So the hollow space inside of a blood vessel is going to be called a lumen. And as we said, when that lumen enlarges or widens, we're going to call that vasodilation. And this is what leads to a hyperemia or hyperemic response. So increased blood flow. If that lumen's larger, it can carry more blood, and we're going to have a hyperemic response. In contrast to that, if that lumen becomes smaller, this is known as vasoconstriction, and this is what leads to ischemia or decreased local blood flow. So if you remember, when you do massage, we can cause a hyperemic response if we massage the area, and you'll see that increase in red tone on the skin. And we're trying to combat ischemia, so we're trying to bring blood flow to ischemic areas. And this process is going to be mostly controlled by the brainstem, in particular the medulla oblongata, but it can also be caused by reflexive action. So if you put pressure on the area, like with massage, or if the temperature changes, you can have, if it gets cold, you'll have vasoconstriction. If it gets warm, you'll have vasodilation. There's multiple ways to control this process. Again, looking more closely at arteries, as we said, they're going to carry blood away from the heart. Typically, this is going to be oxygenated blood. The only exception is going to be pulmonary arteries are going to take that deoxygenated blood from the right ventricle and send it to the lungs to pick up oxygen. And compared to veins, arteries are going to have thicker walls. And the reason this is because we're trying to pump the blood through the entire body. That left ventricle is going to have to squeeze really hard and push that blood with a lot of pressure to get it to go through. And so this is the reason arteries are going to have to be able to withstand that increased pressure from that left ventricle. So some other facts. Arteries are going to be more narrow than veins, meaning they hold less blood. So about 20% of the blood volume is going to be found in arteries. veins, the blood pressure is lower. You're not going to be able to move as quickly. So a lot of the 80% of the blood is going to be within the veins as it returns to the heart. And then as the heart beats, the walls of the arteries are going to expand and recoil. And it's this expansion that we feel as our pulse. So if you feel your carotid pulse here in the neck, and you feel going against your fingers, that's the blood being pushed against those blood vessel walls, and that's what you can feel. And so there's going to be different pulse points of the body. And if you kind of notice on this model here, these pulse points are going to kind of line up with a lot of the endangerment sites of massage. But the idea is because the blood flow is so close to the surface and you can feel it, you don't want to put a lot of pressure on those areas, because if you were to put pressure on those arteries, you would limit the amount of blood flow, and that's the opposite of what you want to do during a massage. So, and we don't need to know the names of these, but they're just going to be named after the area in the body which they're found. So the brachial artery found in the brachial, radial artery down by the radius, popliteal in the back of the knee. So these are good to know. Again, whenever you're massaging, if you feel a pulse, move away from the area because you don't want to be putting pressure on it. Looking more closely at capillaries, again, as we said, they're going to be located between the arterioles and the venules. And we consider these the functional unit of the cardiovascular system. So as I just said, this is where the exchange of gases, nutrients, and waste take place. And this can happen because the walls of the capillaries are very thin, and that's going to be what allows for the diffusion of those molecules to pass through easily. Also, the blood's going to move very slowly through these capillary beds, with the idea that it maximizes the time for the exchange to take place. We don't want to rush by before the oxygen can get to the cells it needs to. It's going to be a nice and slow process. So we can call the blood circulation through these capillary beds microcirculation. And then that third type of vessel, the vein, is going to return blood to the heart. And most of these veins are going to be carrying deoxygenated blood as it sends it back to the right side of the heart. The exception being the pulmonary veins, which once the blood is in the lungs, we're going to have to send it back to the heart. So those are going to carry oxygenated blood within the pulmonary veins. Venous walls are going to be thinner and the lumen's going to be wider. So because there's not a lot of pressure in the system, you're not going to feel a pulse inside of the vein. So the veins are also going to be more superficial in the body. The reason is if you were to cut a vein, because there's not a lot of pressure, the bleeding is going to be a lot slower. Whereas if you were to cut an artery, a lot of times you'll see the blood splurt with each heartbeat. So you're going to bleed out much quicker if you were to cut an artery as opposed to a vein. So the body's going to hide arteries deeper within the body so that it protects them a little bit more. And as far as other specifics, veins are going to begin at that capillary level, and they're going to have these internal valves here that are going to prevent backflow of blood because a lot of times we have to keep the blood moving up against gravity. So these veins are going to help prevent blood from pooling back down. It's also going to keep the blood traveling in one direction, and that direction is going to be towards the heart. So the valves are going to be more common in the arms and the legs. So what happens is these valves open, the blood gets pushed through, and then the valves are going to close back down. And so we call this venous return, and that's going to be the rate in which the blood flows back to the heart. Obviously, as we said, blood in the lower extremities have to fight gravity. So one way to do this is we're going to be constantly pushing our muscles to squeeze the blood up. When I was looking for pictures of veins, I stumbled upon some corner of the internet where leg veins is a very popular kind of hobby. Or should I say looking at leg veins. And there's different ways to increase this venous return. As we said, there's going to be those smooth muscles which in the blood vessels. There's always going to be a certain amount of vasomotor tone that is present in these venous walls to help that blood through. And this is going to be regulated by the autonomic nervous system. So we look at different pathologies, Raynaud's in particular. We're going to see a dysfunction of this autonomic nervous system that affects the amount of blood return. So if you do have a lack of vasomotor tone, you'd have a lack of blood pressure, and this can explain the dizziness when sitting up or standing up too suddenly. This is going to be important because massage clients are going to be laying down for an extended period of time. So after the end of each massage, you want to tell them to slowly get up before they stand up so that they don't feel dizzy. Same thing with chair massage. It's common to see that as well because you're kind of laying face down. Another way to increase venous return is surrounding each of these veins, we're going to have our skeletal muscles. So as they contract, they're going to push against those venous walls. They're going to squeeze the blood up through those valves and help it return back to the heart. So we're always going to need a constant kind of tone in our skeletal muscles, or a constant contraction and relaxation to do this. I'm sure I said at some point, it's not uncommon to see people that aren't using their muscles to pass out if they're standing. So people in a choir or soldiers standing at attention, they're not pumping their muscles, so their blood isn't being pumped back, and eventually there's going to be a lack of blood flow to the brain and they're going to pass out because of that. So if you're ever in that situation, you kind of want to always kind of be shifting around, moving around, especially with your legs, to help that blood return to the heart. And the other way is we have the respiratory pump. So as our lungs expand and contract and breathe in and out, and our diaphragm breathes in and out, it's also going to pump against those venous walls and do this similar action as the skeletal muscles. Briefly, we're going to look at some major veins and arteries. I don't need to ask a lot of questions about these, but there are some common ones that are good to know. The first one being the aorta. You should know the aorta is the largest artery in the body. Again, this is going to be what connects to that left ventricle, and as it pumps, it's going to send blood to the rest of the body. So there's going to be different names to it depending on what it does. Ascending goes up, descending is coming back down. We already looked at the superior and inferior vena cava. And again, these are going to be what drains deoxygenated blood into that right atrium here. You'll probably heard of the term jugular. Jugular is in reference to the veins that drain blood from the head. So this is going to be our right jugular, left jugular. This is the external. There's going to be internal ones that drain blood directly from the brain. The idea is you want to be, as I always say, you want to be careful during anterior neck massage because the jugular and some arteries are going to be close to the surface. You want to be careful not to impinge any of them. And then other arteries and veins, these are just, again, going to be named after the area of the body in which they're found. So femoral artery, you know, is going to be found near the femur, popliteal, back of the knee, tibial in the leg, dorsalis pedis, you're thinking the top of the foot, axillary brachial, so all surface anatomy terms. And getting to the end, the path of the blood, there's going to be two main circuits in which the blood flows. We didn't go over these specifically, but we already know them just by looking at how the cardiovascular system works. So the pulmonary circuit, again, when we say pulmonary, you're thinking lungs. So this is going to be the circuit from blood to the lungs and back to the heart. So the pulmonary circuit you'll see here. And the idea is, again, we're eliminating that CO2 and we're picking up the oxygen. And then the second path of circulation, we're going to term the systemic circuit. And this is going to be the transportation of blood to the rest of the body. So here we can see we're leaving the left part of the heart and we're going through the aorta, into the arteries, into the arterioles, through the capillaries, then back to the venules, back to the veins, and up back to the heart. So here we can see our systemic circuit going all throughout the body, up through the thorax, back into the brain, and all the way back down. And there's going to be a special part of that systemic circuit that we're going to call portal systems. And if you remember in the endocrine system, we saw that hypophyseal portal system where there's a direct connection between the hypothalamus and the pituitary gland, called the hypophyseal portal system. And again, the idea is that it's a direct connection from one area to the other. And this is going to allow transportation of products in high concentration. We don't need to send it through the entire system. We can skip and make a little shortcut to a certain area. A good example would be what we call the hepatic portal system. Anytime you see the prefix HEPA, we're thinking liver. And what's going to happen is part of our digestion, we're going to send blood from our stomach and our intestines straight to the liver. The liver's going to have a lot of functions. It's going to detoxify, and it's going to help with the digestive process and the clearing of toxins. And so that's everything with the cardiovascular system. Again, it's not a very complicated idea. Basically, we have a pump and a bunch of tubes to transport blood around the body. The difference is we just need to know the different names of all the other areas. So, and I have my slides in mixed order. Lastly, we have blood pressure. We'll talk about this more with pathology, but there's ways of measuring the pressure of the blood within the system. And again, we're going to see these terms systole and diastole. Again, systole is going to be that highest pressure within the system. So that's going to be the top number when we do the reading. Diastole is going to be when those arteries are relaxed, so the blood's not pushing against the wall, and that's going to be the lowest number. And the reason this is important is because when we talk about the health of the cardiovascular system, if you're constantly beating blood against those vessel walls over years and decades, this is going to cause damage that's going to accumulate, and the vessels aren't going to be able to expand and contract as easily, and it's just going to kind of be like a runaway train with damage to the system that leads to serious complications. So healthy blood pressure, they used to say 120/80. I think they even lowered that a little bit. But the idea is the lower the blood pressure, the healthier your system's going to be in the long run. But obviously, if the blood pressure is too low, you're not going to have enough oomph to get the blood to everywhere it needs to be. So low blood pressure, you're at a higher risk of passing out. So I know, for instance, my wife has very low blood pressure, and sometimes she'll stand up too quick. The blood can't catch up against gravity, and she'll get that lightheaded feeling. So that's the major concern you have to be worried about with low blood pressure. And the instrument that we measure blood pressure with is going to be known as the sphygmomanometer. So that's the cuff that you put on. All right, and I'll have pathology listed in probably a couple days, hopefully. There's a lot of different cardiovascular pathologies, and it's going to be important to go over because it's one of the number one killers in America is cardiovascular issues, heart attacks, high blood pressure, and whatnot. Hopefully you enjoy your weekend and Memorial Day, and I'll see you shortly.